Hospital ICUs in the United States are in crisis. Hospitals spend 40 cents of every dollar in the ICU, and yet the performance of our country's ICUs is suboptimal. The ICU is under great strain due to the aging population and the lack of ICU staff. Lack of standardization is contributing to preventable errors and excessive financial expenses in the ICU. Advanced ICU Care helps improve ICU patient care with a 24/7 tele-intensivist solution, a robust quality improvement program, and support to your already overburdened medical and nursing staff. Watch how we collaborate with a hospital like yours to address this national ICU crisis.
Margaret Smith is a 61-year-old mildly obese woman with a history of emphysema. She arrives at the emergency department complaining of shortness of breath.
Hi, I'm Dr. Thompson. How are you feeling?
Tests show that Mrs. Smith has left-sided pneumonia with mild hypoxia. With her history of emphysema, Dr. Thompson contacts her primary physician, Dr. Carol Wilson, with his recommendations.
So I'd like her to go to the ICU for observation and just to make sure that her condition doesn't deteriorate.
After making arrangements to have Mrs. Smith admitted to the ICU, Dr. Thompson contacts Advanced ICU Care intensivist Dr. Mike Walter. Advanced ICU Care immediately becomes involved.
Okay, Mitch, we'll get her settled in the ICU and keep a close eye on her.
Mrs. Smith is now in the care of the ICU nurse. The physician and nursing staff at Advanced ICU Care now have full monitoring access to the patient from now until discharge. Continuous and ongoing evaluation of the patient begins through technology that supports real-time bedside monitoring. Dr. Walter has an initial conversation with the patient by remote camera.
Hi, Mrs. Smith. I'm Dr. Walter with Advanced ICU Care. I'll be monitoring your progress.
All information from the ED and the ICU vital signs are reviewed by the Advanced ICU Care nurse, who then drafts an admission note in the patient's chart. Orders are written by the intensivist, Dr. Walter, to continue the ICU care. The Advanced ICU Care nurse then notifies the bedside nurse so that care can begin. Later, the patient's condition is deteriorating.
I noticed that your breathing looks like it's more difficult than earlier. Is that right?
The Advanced ICU Care nurse contacts both the bedside nurse and the Advanced ICU Care intensivist. The intensivist joins the video conference, assesses the patient, and orders a blood gas and elective intubation. The hospital's anesthesiologist is notified.
Hi, Dr. Jones. Mrs. Smith has respiratory failure, and I'd appreciate it if you could intubate her.
The Advanced ICU Care intensivist contacts Dr. Wilson, the primary physician, after reviewing the X-ray.
Thank you for the update. I'll check on her in the morning.
Would you like a pulmonary consult to see her?
Oh, good idea. Let's call Herb in.
Bye-bye.
The intensivist now returns to the family to update them on recent developments.
Hi, Mr. Smith and Kathy. As you can see, Margaret's condition has taken a turn.
Immediate access to the Advanced ICU Care intensivist gives the family a medical expert to consult with at any time. It is comforting for the patient and loved one. After several days of careful collaboration, Mrs. Smith's condition improves. She is extubated and begins feeling better. The combined skills of both the Advanced ICU Care staff working with the team at the hospital have been successful. This is how Advanced ICU Care addresses the ICU crisis. Advanced ICU Care helps improve ICU patient care with a 24/7 tele-intensivist solution, a robust quality improvement program, and support to your already overburdened medical and nursing staff.
As the nation's largest tele-ICU services provider, we are ready to help. Thank you for watching.